Okay, this video could have a couple different names. The first one would be, can irritable bowel syndrome be cured by a vegan diet? Okay, the other one would be, are medications used to treat irritable bowel syndrome for chumps? Okay, and again, I'm going to show you the contrast between how conventional medicine approaches a problem versus how Dr. McDougall approaches a problem. So here's an article from a conventional medical journal. It's called, Gastroenterology. And they say irritable bowel syndrome is a complex syndrome, difficult to manage. Yeah, notice that. It's complex. They're like saying, we don't really understand it, and it's difficult, but we'll try to slow it down with our pills. That's sort of like the code language. They do that for tons of diseases, okay? Then they say, there is evidence to support, pretending there's evidence that they use science is what they're talking about. I'm going to call this atheist science. Atheist science is inherently evil, and if you think those are strong statements, then you're an idiot, okay? I'm telling you the truth, and you can take it or leave it. This is how stuff really goes down in the real world, okay? So they go, there's evidence to support treating IBS with loperamide, a laxative, psyllium, artificial fiber, bran artificial fiber, these other medicines, lubiprostone, linactide, amitriptyline, a powerful, tricyclic antidepressant, triamipramine, dazipramine. These are antidepressant drugs, which the smartest psychiatrist will tell you cause a slow onset lobotomy, okay? Treating yourself for a dietary disease with something that causes a slow onset lobotomy, in the opinion of some psychiatrists. Okay, then citalopram, another psychiatric drug, okay? And then fluoxetine, that's Prozac, which has so many terrible side effects and kills so many cells, they recommend it for chemotherapy. And this is in the mainstream standard journal of gastroenterology, okay? Do you understand something? This is insanity. This is not even stupidity. This is insanity. This is what I told you. If you have atheistic scientists, a patient's life is dirt. It doesn't matter. This is evil. It's so stupid, it's evil, okay? Paroxetine, another powerful selective serotonin reuptake inhibitor, antidepressant. Dicyclomine, okay, that's a powerful drug. We're going to talk about that one in a moment. And then peppermint oil, rifaximin, ketotifen, pregabalin, gabapentin, a real positive neurologic drug. Octreotide, another powerful drug. And there are many new medications being investigated. And then they say some of the most promising of the new medications include novel pharmacologic approaches, most notably the dual mu opioid receptor agonist and the delta opioid antagonist, JNJ270-18966. It still has a research name. Okay, so to people who don't know medicine, this sounds real impressive. To people who know medicine like myself, I've been a doctor over 30 years, this is nonsense on stilts, okay? Now, let's take a look some more about IBS, irritable bowel syndrome. So when you start reading about it, you'll see, well, you get abdominal bloating after eating a meal and gas, sometimes diarrhea, sometimes constipation, sometimes quite a bit of abdominal discomfort or pain. And then there's a guy named William Bolshevitz. He's a gastroenterologist, and I think he's pretty good. They often call him Dr. Will or Dr. B. And he is a pretty smart guy. He did a gastroenterology fellowship. He knows a lot. I think his book, Fiber Fuel, is good. But I'm also going to tell you something. Whenever you see a difference between what he says and what McDougall says, always go with McDougall. McDougall's smarter than him. McDougall knows more than him, okay? He's a little bit, trying to make money, hustling out there. He's a young guy. I'm just telling you, I've tracked down a lot of what these guys say. Bolshevitz is smart. He's good. He knows a lot. So I do check what he says because he's worth studying. Okay, but McDougall's better. McDougall's the best doctor who ever lived. Whenever there's a discrepancy, go with McDougall. Okay, so here's what Bolshevitz says about it first. He says, before 1980, there was no term for IBS. Now, as many as 20 people, 1 out of 5, have IBS. It's a problem with the gut microbiome, the gut bacteria. IBS can be quote-unquote cured. He doesn't like to use the word cured. He would rather say it can be controlled, can be slowed down, can be sort of prevented. He doesn't like to use the word cured because he points out as soon as they go off the healthy diet, it comes right back. Okay, so if you stay on a healthy diet, which you should do anyways, it can be essentially cured. Okay, but he also recommends supplements potentially, so I'm going to show you what McDougall does in a moment here. But just to teach you a little more about the disease, the pain usually goes away right after a bowel movement. I'm going to show you some pictures and some testimonials too in a moment, but I just want you to know a little more about the disease. What it sounds like to me is basically you eat the bad diet and it messes up your gut flora and that causes abdominal pain. I'm also going to tell you something that I consider, I don't know the medical term for this, but there's basically, sort of a battle, a war going on in your gut for which bacteria are going to dominate. If you always eat the healthy food, then the good bacteria are always in control because they eat the fiber and they control the colon. And there's no problems. Your gut calms down. What a lot of people do is they'll eat one meal okay, one meal crappy, a little bit of good food, a lot of bad food, and then these bacteria are battling out. The good bacteria that eat fiber are battling out with all the bad bacteria that thrive on all the meat and the processed food and the oils and stuff. So what you want to do is just support your good gut bacteria and let them dominate your gut, and everything will calm down, everything will be cool, everything will work the way it's supposed to. But if you keep going back and forth, going on and off the diet, seesawing the diet, then there's a constant battle, and you're going to get the farts, you're going to get the bloating, you're going to get the cramps. Okay, so once you've optimized the diet, often the symptoms will go away. Other symptoms of IBS, feeling of incomplete evacuation with bowel movements, mucus-like material in the bowel movement. IBS notoriously can be made worse with psychological stress, coffee, caffeine, okay, milk, which causes constipation, paralysis of bowel contraction, alcohol, artificial sweeteners. Yeah, the same things that cause leaky gut. IBS is associated with increased risk of leaky gut. And here's what conventional medicine says. There is no cure for IBS. Just like they say there's no cure for all these other diseases. No one knows what causes hypertension. No one knows what causes diabetes. No one knows what causes atherosclerosis. Just take our pill and try to slow it down. That's all horseshit, okay? So here's just some of the medicines they use. Diarrhea medicines, like loperamide, opioid, Imodium, laxatives if you're constipated, like magnesium hydroxide, polyethylene glycol. Who the hell would want to take this crap? Tricyclic antidepressants like imipramine, we talked about that. SSRIs, serotonin selective reuptake inhibitors, antidepressants like Prozac, is a freaking totally toxic drug. Probiotics. If you're interested in Prozac, take a look at my video called Who's the Crazy One? Who's the Crazy One? About Prozac. You'll be amazed how terrible that drug is. Okay, antispasmodics like dicyclomine, Bentyl. I had a friend recently who said their kid was prescribed Bentyl by a gastroenterologist. Okay, that's insane. And these drugs sometimes are being given to minors when the parents aren't even present. These are dangerous drugs. Wait till we look at the side effects that this drug can cause. So now we're talking about Bentyl, dicyclomine, for a little bit of gastric bowel upset after eating a meal. Dicyclomine potential side effects: drowsiness. If you're driving, you could crash your car. Weakness, confusion, agitation, hallucinations, unusual behavior, problems with memory or speech. This sounds like the person's having a freaking stroke. Okay, a medication that can cause a stroke because you got a little bowel gas or the farts or some diarrhea. This is insane. Problems with balance or muscle movement. Again, it sounds like a stroke. Difficulty swallowing, blurred vision. These are all the histories of a patient with a stroke. Okay, that's insane. You can have memory loss, inability to speak. These are major neurologic side effects, okay? Accelerated heartbeat, fluttering heartbeat. That means you can get cardiac arrhythmias. Maybe, I'm not sure which arrhythmia, but that's pretty frightening, fluttering heartbeat, okay? Now, Dr. McDougall newsletter, 2002, dietary treatment of IBS. Okay, this is what Dr. McDougall says. He wrote one newsletter, I think it was September 2002, In Search of the Perfect Bowel Movement. Then he wrote another newsletter called Dietary Treatment of IBS. That's November 2002. So you just go to Dr. McDougall's website. It's drmcdougall.com. His newsletters are the best health newsletters and nutrition newsletters anywhere in the world. That's where you go. Okay, let's see. And he says the contents of the intestinal tract equals the American Western diet, the SAD diet. And it's the obvious place to look when you want to see the cause of IBS and to figure out the cure. Okay, this is Dr. McDougall continuing here. He says, there are many qualities of this diet that make the intestine inflamed. The diet is high in fat. Fat is associated with increased risk of leaky gut. Oils, as Dr. McDougall says, they're toxic to the gut lining. Saturated fat is also toxic to the gut lining and increases the risk of leaky gut. Indigestible milk sugars like lactose. Diets that are low in dietary fiber. Yeah, the good gut bacteria feed on fiber. If you don't eat fiber, then you don't have enough good gut bacteria to make short-chain fatty acids like butyrate to maintain the tight junctions of your intestinal lining. Plant chemicals, they lack these things. Okay, many of the food proteins cause allergic reactions. Some specific food intolerances that are thought to be involved in over half of IBS cases. The most likely offenders are milk, wheat, and eggs. So wheat can potentially be a problem for some people. I would recommend if you're going to eat wheat, eat one of the organic single ingredient versions. Modern stuff is potentially GMO'd and can have all kinds of problems. But milk and eggs definitely should not be at all a part of your diet. Okay, Dr. McDougall continues. My experience has been that a change to a low-fat, plant-based diet, a diet based on starches, vegetables, and fruits, results in almost immediate relief of bowel cramps, diarrhea, and constipation. So isn't that funny? All of these guys, the professionals, the gastroenterologists, in their journals say nobody really understands it. It's a complex disease, difficult to manage. You might need to take 3, 4, 5, 6, 7 medications for it. Okay? And McDougall says, look, just eat my diet, you cure it. Okay? McDougall continues, this is due to many qualities of the plant foods. For the few people who continue to have symptoms, I'll eliminate wheat, to which some people may be sensitive. As a last resort, I will ask some people to follow an elimination diet. And he has an elimination diet at his website, drmcdougall.com. Now, let's take a look at some of his patients. So here's some guy, his name is Phil. He cured irritable bowel syndrome and he took up competitive cycling. So he got so much better that he was comfortable, competitive cycling where he's out, in the fields, and you got to take a number 2 out there. It's a little bit inconvenient to say the least. All right, so he's got pretty good confidence in his bowels that he's going competitive long-distance cycling races. Okay, and here's another guy who was a teacher, and his poor intestinal health saved his life because once he went on the McDougall diet, he cured himself of his irritable bowel syndrome, and then he realized that he simultaneously prevented all these other diseases that he saw his cohort of age-like persons having problems with. So this is, again, a perfect example of conventional medicine plays dumb. Oh, we don't know what to do. Take our pill, try to slow it down, a bunch of BS, and potentially going to cause the patient life-changing, devastating side effects. And these people just eat the McDougall diet, the low-fat, 100% vegan diet, whole food, single ingredient, no oil, cured. Okay. So, I don't know if every patient's going to be cured. Is it correctly being diagnosed? But, given the fact that they didn't even have a name for it before 1980, suggests it was pretty rare. So, it's obviously worth trying a diet first before you take medications that can potentially cause a stroke-like symptoms. That's insane, and they shouldn't be prescribing meds like that to minors without the parents at least being aware of it. Not that the parents would know any better, but still, I think you see what I'm saying.